Today's episode is brought to you by Censinet. Healthcare organizations face mounting enterprise and third-party cybersecurity risks across vendors, applications, patient data, and medical devices. The Censinet Risk Ops platform is the only cloud-based risk exchange that's purpose-built for healthcare, connecting hundreds of hospitals and health systems and more than 50,000 vendors and products. Take the risk out of healthcare with Censinet's collaborative and community-led network. Learn more at thisweekhealth.com/Censinet.
I'm Bill Russell, creator of This Week Health, where our mission is to transform healthcare one connection at a time. Welcome to Newsday, breaking down the health IT headlines that matter most. Let's jump into the news.
Hey everyone, welcome to Newsday. I'm Drex, and there's a whole gaggle of geese on the show today.
So we are the gaggle.
Sarah Richardson, say hi.
Hi, Sarah Richardson.
And Ed Gaudet's with us too from Cincinnati. How you doing, Ed?
Hey, Drex, welcome back.
Thank you so much. It's good to be here, and it's good to have you on the show. I've been on your show a couple of times. I saw my name on the back of your t-shirt.
Wait a minute. You've been on Ed's show?
Bill, you're always
Sarah,
invited.
Have you been on Ed's show?
Sarah, you're always invited.
Oh
I
my
haven't,
God.
but it's
Okay.
not like I haven't,
Now you're getting invites.
to get prime time.
You want to be on because when we go to 200, we're getting close. We're going to send out the next installation of concert t-shirts.
Oh.
And Sarah, your name could be on the back of that.
It's
That
so
would be so
and-
good.
I can't believe I don't somewhere in this office have mine here, but it has Risk Never Sleeps on the front, and then it has like everybody's name who's been a guest on the back, and it is
That's
like
right.
a who's who of cybersecurity and healthcare leaders.
And you're going to do 200 and you're going to hand embroider each one? That's amazing.
Yes, Bill. Bill, we're going to need extra space for your name.
Oh,
Bill.
man.
Bold
All right.
italics and a special font.
I love
That's
it.
right.
This is the first Newsday we've done,
Yeah.
and we're already completely sidetracked.
Yeah.
Is this
Yeah.
the
Let
new
me,
format?
let me,
Oh, this is the new I'm the first on the new format.
Yeah.
You are the first on the new format.
my
Yep.
God.
I knew when
Oh,
I knew
hold
when your
on.
name showed up, I was like,
Yeah.
this is going to be, well, I think I
I
even
love
said
it.
in the email, it's going to be fun and probably a little chaos. This is what's going to happen.
Dude, I got multiple plates spinning, so you'll keep me active anyway. I thought we'd play Jeopardy too. I came up with a new Jeopardy.
Oh my
I did.
Be
It's like
careful.
Celebrity Jeopardy. That's still like my favorite SNL skit of all time.
I tell you, just be careful. Ed spins his web, and all of a sudden you're sharing stuff you didn't want out on the
Who are
internet.
the ad wizards that came up with that, Bill?
All right, I'm going to hit a couple of news stories here, Ed.
All right.
To try to
boy.
get us
Here we
on
go.
track, and then we can kind of just see where we want to go from there. There's a thing that's happened over the last few days from a company called SalesLoft, and they have a product called Drift. It's like an AI chatbot that a lot of companies have integrated into their product as a way to engage customers. And the bad guys have figured out how to breach the SalesLoft Drift chatbot guy and then move vertically inside to Salesforce and Slack and all the things that Drift is connected to. So what are you thinking about that? Have you seen any of that splash over into healthcare? Have you heard from anyone struggling with their SalesLoft Drift, or just in general talk about third-party risk?
What's AI?
We can't have a show without talking about AI and maybe chatbots.
Yeah. No, it's another example of a supply chain risk gone bad. This time it's integration, right? So
Yeah.
it's integration through the Salesforce partnership program. We haven't heard from any customers yet directly. I'm sure it affected somebody out there in healthcare.
Well, we have two cybersecurity experts on. And I'm not putting you down here, Sarah, because I'm not putting myself in this category, but we have two experts on the line. I'm curious, if I put you guys in charge of threat actors, like you're in charge of a group of threat actors, how would you be utilizing AI? This is for Drex and Ed. Like I'm gonna bankroll you. I'm gonna be your VC to
Yeah.
get your hacking group up and running. How are you going to use AI to infiltrate my healthcare system?
Yeah. This is one of those things we've kind of already seen. So this idea of a 0 day that comes up, or 0 day is announced by a company or a product. We have a problem. We haven't figured out the patch yet, but just know that this is a problem that we're having. So now the arms race is on, right? How do I get from the 0 day to an exploitable product that I can now run at all of those companies who run that product to try to get inside and steal data and do ransomware and all the other nasty things that they do. So it's all about speed. The company's trying to build a patch to fix the problem, and the bad guys now are using AI. This used to be it is a complicated thing. You have to take the 0-day, the announcement, you have to kind of reverse engineer it, figure out where the problem is. Then you have to build the exploit. Then you have to figure out how you're going to field the exploit. And then you have to field it and execute the business plan, right, of the bad guy. And this is where AI has really helped that bad guy go faster, because it's much easier now. And a lot of people can do this without having expertise and how to reverse engineer 0 days and create an exploit and then figure out how to field it. And so if I was a bad guy and I had a bunch of money, that's probably one of the places I would put it.
Are there specific devices you're looking at? I mean, do you care as long as you get on the network and are able to?
I don't think I use it that way. And Drex, I don't think you answered this question either.
Oh, okay. Go ahead then.
I might use the deep fake. I might use the deep fake aspect of it
to
get credentials. I might send out a Zoom invite to somebody and get on a Zoom invite looking like that person's boss or a colleague and try to, from the help desk possibly. There's a whole group of hackers right now that are leveraging AI this way to get in.
So you just want to come in the front door. Like,
why not? It's
good
easy.
Credentials, get in, start tooling around.
Yeah,
like
exfiltrate, sit around on the network, look around, really understand where the value is, and then hit them hard. Or maybe coordinate it in a way that takes down the entire industry.
I don't think I'll get in trouble. I think the statute of limitations is off on this, but the last time I had Deloitte do a white hat attack on St. Joe's, the first thing they did is they set up a website. Instead of stjoes.org, it was stioes.org. It looked
typo.
I mean, it was perfect. It looked perfect. And then they sent the email out to a bunch of people. And I think they had only doing that for like a day, I think they had 85 good credentials that they could get into the system. And then once they were into the system, then they could start to tool around, as you said. I mean, it's still the easiest way to get in, isn't it?
The easiest
It
way.
is. I'm curious. Can we go on the topic, the initial topic? So, how do you think they got into? How do you think they got into the SalesLoft drift? Do you think it was a phishing attack? Because they haven't really declared the entry point yet.
Right. And I think you're probably right. It's probably was some kind of a phishing attack, because it looks like they somehow compromised the OAuth credentials to be able to get into Drift. And then from there, they moved vertically. But how did they get that first nibble or that first bite at the apple? Yeah. Humans are the weak point in the system. I mean, not that technology isn't weak too. There was a bunch of stuff now being published about all of the AI production of software now, coding, and how unsecure a lot of that stuff is. And so we're laying the foundation for a bunch of other holes that we're gonna be.
You seem surprised.
No, I'm not.
We're going to end up with more followers now, because they're going to send us out to all the physicians and the nurses. And they're going to be like, this is how we really think about you guys. Like, you're the weak link. If it weren't for you, we could have really secure networks.
It doesn't matter if they're doctors and nurses or if they're,
It doesn't.
yeah,
No,
it's, I mean, it really is amazing. I think about even my days at CrowdStrike, some amazingly good phishing emails that even hardcore cyber pros like me fell for, because they're really good. And AI really has made them better, as you say, Ed.
And then we do stupid things like put policies in place that say after like the second offense, we're going to like fine you or fire you or something. So then nobody brings any of these
It's almost a disincentive.
It is. It's a disincentive. It's crazy. So,
I clicked on that link, but I don't want to tell anybody.
But I don't want to tell anybody. It's my second strike. I could be fired.
Yeah. What's the best approach for that, do you think?
I think you have to educate. What was the best approach for hand washing, right?
Is there ultimately any penalty for clicking on stuff?
I don't know. I don't think so, because it's just getting harder and harder, right? So let's assume the next big thing comes out and you click on it after the third time, but it's some new innovation that got you to click on it. Is it your fault? Probably not. I think you hire good people, you do your background checks, you trust them.
You and I have talked about this before, that whole, you have to create a culture where it's okay to say like, I clicked on something and I don't know, I might have made a mistake. And you got to be able to say that and not get smashed in the mouth for it. If
Agree, because no one will talk. Everyone will shut up. Yeah.
it's all about speed. I mean, if
all
you
about
make a mistake,
speed.
you got to be
It's all
able to
about
catch it quick. And if you don't say anything, then it goes on for a while.
So the category is hot for
That's what I was
hackers.
going to ask you. Are
Yeah,
you really going to do Jeopardy?
The category is hot for hackers. And here's the clue. Ziggy's Space Invaders.
Sarah and Bill are just looking at us now.
The clue is Ziggy's Space Invaders. Come on, this one's easy.
This one sees. Well, there's a reason I don't go on Jeopardy.
All right, I'll give you this one. Scattered spiders from Mars.
Yeah, I
See
would
what
have
they
never
did there?
gotten that one.
See what they did there? All right, the next one. Stipe's sleepy smiley archers. Got it.
Well, I hear Stipe and I think of Michael Stipe and I think of REM. So if I'm on the right path there, then I'm going to just say who was REM.
I'm gonna
No,
say
you
it's
gotta-
shiny hunters, happy people, or something like that.
Shiny happy hunters.
Like shiny
Yes.
happy hunters. Okay.
Okay. All right. Well, here's what part of your trivia. I was
Okay.
my senior year. My friends and I for Halloween we all dressed up as shiny happy people because that was the year that the
you
song was out. So we had like these metallic costumes,
Nice.
silly masks. But yeah, it was a very clever costume.
No, I met Michael Stipe in a bus, on the back of a bus once, trying to break back into the concert that I was thrown out of.
Oh,
Yep.
Yeah, he said nothing to me.
well,
As I was
did you-
babbling
how
about
did
how
you-
much I loved him and how I needed to get back into the concert. And I will not act like an idiot. I'll sit in the corner and just listen to the music. He just got up, walked out, took me to the back, opened up the door, and let me in.
security.
Feel
He was
like
in
I'm
the back.
at-
He was
feel
in the
like I'm
back of
back
the
in
bus.
middle school, hanging out with the cool kids, going, I don't know what they're talking about.
Meanwhile, Bill was listening to Enya.
Exactly.
That's true.
Oh.
But I could go to Enya too. Bill, what did you think about that Enya musical? You were
Oh, that was actually, I was hoping it was real and I could buy tickets, but I guess not.
This is the
There's your
part of the
next tag,
conversation
Ed.
where I'm going to step
Create a
aside.
whole thing for buying tickets to see Enya at this fair, and Bill's going to click on that link all day long.
we could produce it. We could produce it. Drake, you got a couple other stories too. You had CISA, right?
I did. Yeah, there's a law called CISA. It's the Cybersecurity Information Sharing Act of 2015. This is a law that was put into place. It's supposed to expire after 10 years or be renewed after 10 years. It seems to be in some kind of like maybe turmoil, like maybe it's not going to get renewed. And the whole idea behind this CISA, not the organization CISA, but the law CISA, the challenge is that it creates sort of like a safe harbor where when you've been attacked and there's something going on, you can actually talk about it and share information about it without the fear of having that used against you later. And so there's a lot of folks that are kind of scared about this CISA law disappearing off the books. What do you think?
Yeah, it's a problem. Government, get your act together. Let's go. Like, we need this. Like, what are you doing? You're back from recess.
What's the rationale for doing away with it?
I don't know that there's really necessarily a rationale. It's one of those things where it's like the law has to be renewed after 10 years and there seems to be no, I don't know, consensus. We can't get parties together to say like, this is an important thing that we should actually do.
Politicians, Bill.
It's politicians.
The pace of government, 10 years was not enough time to evaluate the effectiveness of this. But essentially, if I understand you guys correctly, because I don't know the ins and outs of this, it's a framework that if I get attacked, I'm going to share the information with other people within our industry so that they can respond. Is that it?
Yeah.
That's pretty much it in a nutshell.
Yeah. And sharing it at the pace that makes sense and is effective, right? Versus you can eventually share it, but it's got to go through all these legal hurdles. And by the time it gets shared, it's too late at that point, right?
Maybe it should have been for 15 years and they would have enough time to do it.
That's note to self. Make the law longer.
Or just make the law a law. And then when you decide you don't want it anymore, don't make it so it has to be renewed. Just it has to be repealed.
Don't renew the law.
Yeah.
Are there others in this category in the cybersecurity space? I mean, there's been a lot of change in the cyberspace since we've had the new administration. I remember just prior to the new administration coming in, there was really strict things coming towards healthcare, and everyone was sort of up in arms like, oh my gosh, if this goes through, we're in trouble. Like, we're not going to be able to do half of these things in a timely fashion. And then it all sort of evaporated overnight. Drex is looking at me like he knows. See, I just know concepts. I don't know the specifics.
What
No,
Bill's
no,
referring
you're
to is the
spot
national,
on.
the NPRM that came out around the HIPAA updates and a lot of
That's right.
stuff that was in that. And in the proposed rule, and then the new administration came in and it's sitting on a back shelf somewhere in somebody's office and nothing's ever going to be done with it. And that's why it's called a proposed rule too, is that they put stuff out there and then people make comments and then they adjust and change the rules around that. But it just never went anywhere. Between
Hardline.
that and cuts at CISA and lots of other things and one of the other stories I was going to talk about was that there's an industry group that is focused on, there was a 4-year cyber grant program for state and local governments who traditionally don't have a huge amount of money to put into cybersecurity. They don't have necessarily the cutting edge kind of staff go to tech companies, and you have state and local government employees who are working their butts off and doing their best, but they've only got what they've got. And they're responsible, obviously, for like, are the toilets going to flush tomorrow? And are other things that are really important to us going to happen? And so those grant programs are ending. And there's a lot of concern, obviously, about whether or not what happens in state and local government, which are being attacked pretty vigorously. We see regularly cities being attacked and state governments being attacked. So all of this kind of conspires to I'm not sure the government's necessarily going to come to help in the near term. Maybe in some places they will, but this is more reason than ever for us to build community and have these conversations, for laws like CISA to be renewed so that we can help ourselves as much as we can help ourselves, because I don't know that anyone else is riding to the rescue.
Well, AI is riding to the rescue. So
Tell me more.
yeah, just be patient. You're actually be working for the AI overlord soon. You won't have to worry about these people. It'll be
I
the
saw
rest.
somebody say something the other day about, I, for one, welcome our AI overlords.
That's right.
If you want to suck up to the AI overlords in advance, that probably
Yeah,
would be a good
yeah.
thing.
I'm going to throw something out here. So OpenAI did their launch of ChatGPT 5, and they had the little section in there in the middle where it was healthcare related, and you had a person that came in who was fighting, I believe, cancer. And she talked about how she used ChatGPT to really understand the diagnosis and understand the test results and understand all those kinds of things. And it turns out just this week, OpenAI appointed Ashley Alexander, a veteran from Facebook and Instagram, as VP of Health Products, signaling a deeper ambition within healthcare technology and patient access transformation. I'm sure that makes healthcare people crazy when just everything about that makes them crazy. It's like, why would you not bring somebody from healthcare who really understands healthcare?
But why does that make you crazy? How many failed Microsofts going into healthcare, Google going into healthcare, Amazon going into healthcare? How many times do we have to relive this, right?
Yeah.
Oracle buying Cerner, right? I don't know.
Do you think
Well,
at some point they get it right?
I don't know if they do ever get it right. I thought Amazon would get it right, actually. I was a big proponent. I'm also an early investor in Amazon. I really thought they'd figure it out, but they haven't figured it out.
But here's the thing, and every doctor will tell you this. I mean, Dr. Google was a thing for many years. People would take their stuff, they'd go to Google, and it was worse, right? Because they would bring in these piles of paper to the doctor visit and say, I think I have bubonic plague or whatever it happens to be. And the doctors would just shake their head and be like, oh my gosh, I can't believe this is happening. The difference now is, instead of getting 55 sites that I have to wade through and print stuff out, it feels a lot more like I'm talking to somebody who has a medical degree who is giving me answers. Now, I've done enough programming and other things on this thing that the reason it scares me a little bit is I know it's going to be widely used for this purpose. And on the programming side, every now and then it does something that I look at it and go, you didn't understand the question. Like, I don't know where you're going, but let's come back to where I started this question and let me ask it a little differently so you don't head off whatever field you just went to. I want you to come back here. Well, it's okay if I'm doing it with programming, and it's okay if I have enough background in programming to look at it and go, that AI just went into a dark place. But in healthcare, if I asked the question, I'm not sure I'd have enough knowledge.
No clinical background. Yeah.
No clinical background to say. And so that's who's going to be accessing this. I don't know, Sarah, are you concerned about this at all?
I am. And so I mentioned I have the big ed questions. This is most likely for the group as well. you consider how AI is being used at the point of care. So you have, let's just make it up, AI stethoscope, ambience a big deal across the board, even some of the predictive tools. We used to call that decision support, but it's taken on a whole new look and feel these days. How are we talking to the board and the executives about the cybersecurity risk? Like, we want to stay innovative, and yet now we have this variable that is still being learned and morphed every single day. What does that conversation look like to the board about how to stay innovative, use these new tool sets, and yet a level of risk and awareness that still keeps us resilient when it comes to patient care?
A lot to unpack, but first of all, we have to change our perspective, the way we think about third-party risk. And most people have been thinking about it from a vendor and product perspective. And what we believe is, in order to really get your arms around risk in a holistic level, you have to think about it from a business process and critical function perspective. And so all of your business processes today and critical functions are supported by technology. And that technology, that relationship has to be considered, has to be mapped in really order to get a sense for the true risk in your organization, the true priority of risk or potential risk, whether it's systemic, like we saw with Change Health, or whether it's a single incident. And part and parcel with that is thinking differently about how we manage risk to be much more inclusive, not based on silos, right? So for decades, we've been managing risk in the silo of cybersecurity. And that was necessary at some point, but today it's not sufficient, because we all have learned over the last couple of years that risk is so much bigger than just that silo, that slice of cyber. It does impact medical devices, and oftentimes medical devices sit outside of cyber. So now you've got two functions that are pretty much duplicating efforts, not coordinating, right? Then you talked about resiliency. You mentioned continuity, disaster recovery. That often sits outside in its own group too. These things need to be consolidated. They need to be brought together under the view of business process and critical functions. Because ideally, if you understand your critical functions in a healthcare setting, to your point, the point of care, that's a critical function. If I can't deliver care, I cannot deliver business. I cannot generate business, right? I cannot service my patients, and I can't do it safely. And so in order to get my profile correct, my tolerance, my risk control set properly, so I can actually function in the context of the things I need to do to support my business, I better prioritize that, because I don't have infinite resources. I can't spend infinite dollars either. So getting that priority lens over those critical functions, the business processes that matter, is really is important.
So Ed, if you're the CEO of the hospital, where do you want that function to reside? How do you want to see it? Oh, governed is probably the best word, although not my favorite in this case, but you're a brand new CEO at a hospital. You walk in, this is a truism. Where do you see this living?
Yeah, it's a great question. First of all, forget about where it's living so much, is I would say it needs to be elevated at a level that is on par with the finance committee and audit committee and comp committee at the board. And so right out of the gate, change the structure and function of the board to include cybersecurity. If it's under the CIO, the CISO, the head of GRC or compliance, as long as it's at the board level.
What about the makeup of that board? Because I had that group, and every time we went, it was like I was educating. I mean, I hope none of them are listening, but it was like educating 101 on cybersecurity. There was always one person in the room who's like the tech person for the board, who acted like they knew what we were talking about, who had no freaking idea what we were talking about.
The individual at the board level needs to communicate, just like a finance committee communicates the finance details at a level the board understands, or the audit committee communicates the audit, not the details behind the audit, but what's necessary for proper governance at the board level. The same, cybersecurity, it's so fundamental to survival. And yet we don't have an individual at the board level governing cybersecurity, translating on behalf of the board, not bringing in a CISO, not bringing in a director of IT to communicate on a PowerPoint slide, but talk about it in terms of critical functions, in terms of uptime and resiliency and continuity. That's what they care about, or gaps in the program that need to be funded because we understand where we are given our peers, right? Not in terms of what the latest and greatest patch of CrowdStrike.
It's not a technical conversation.
Business conversation.
Exactly.
It's a risk conversation because risk is business. It's not technical. And that's the problem we have. 'Cause we're
It's
still
interesting
treating risk
too.
like it's technical.
It's interesting too, because we have a lot of conversations about risk at the board level from a clinical perspective, or
Absolutely.
from where we make mistakes or where there's a potential for mistakes. So we have maybe the wherewithal to pull this off. We just need to broaden that conversation out to the rest of everything depends on technology.
Right. You're framing the Da Vinci in terms of the business, not in terms of the mechanics behind how the thing works at the
Right.
board level, right? Board doesn't care about that. Why is it important to the business? And what does the board have to know in order to do its job to govern appropriately, right? And I think there's an impedance mismatch between risk, cybersecurity, and the board and governance. And I mean, we're getting better at it, but it's so slow. It's people. It's Soylent Green.
Lord.
To go back to a movie reference.
Oh my
from the
gosh.
70s. Sorry
That's
about
the
that.
classic.
Charlton
Hey,
Heston.
Sarah, you have anything else you want to ask Ed?
One last question.
Okay.
Ed, is
Yeah.
because the newness of just say AI and some of the generation that's occurring out there, we're seeing more and more pilots. And yet philosophically, we always say a pilot is bound to fail because it's rarely time bound. It's really not often measured. And yet at the same time, we're seeing like 5 head-to-head pilots. I'm curious, specifically from a cyber perspective, at what point do you know the pilot has been successful? And do you prefer a pilot when it comes to a cyber and risk perspective? Or do you know that if it's the right solution, let's go for it and put the same parameters in place that we would for a controlled environment like a pilot?
The pilot is sort of an illusion of control that one puts in place to say, we got this. We're going to manage the risk of AI by piloting it. The reality is AI already exists. It's already there. It's in existing products and vendors that they have deployed that they're using today that they don't even know about. That's the bigger risk in the organization. So go ahead and do the pilots for new stuff. I think that's fine, but you got to get a handle on your existing inventory. You have to understand. I remember when AI came out and Acrobat jammed AI down our throats. They put in this AI capability by default that you couldn't even turn off. I looked at and I couldn't accept it, so I had to uninstall Acrobat. Reddit blew up, and eventually they recanted it and they took it out, put it as a knob. So I think organizations need to be much more vigilant about policy and principles as it relates to adoption of technology. Have the courage to say, if you don't go through our process, we're not going to buy you, right? Have the courage to say, we're not going to renew the contract if you don't fix those corrective actions we told you about 9 months ago.
These are conversations about how you build your contracts and language you put in your contracts up front
Yes,
too,
and-
right? Because
Exactly.
we had this huge conversion during COVID. We went to a bunch of software as a service products, and now we have AI. And on Thursday, you open up the app, and like you said, there's a new knob, and it's an AI thing, and nobody told me about it. It's just now my whole
everyone's
company
using it.
has access to it.
Nobody stopped, did an assessment on the new capability, right? And that's why these certificates are dead, right? The certificates of the SOC 2 certificates and others are dead. It worked decades ago when technology changed twice a year, maybe at the most.
Right.
It changes every single day, hour, minute. How can you manage on a certificate that once it's published, it's already out of date by 6 months?
On the product side and on the risk side, on
Yeah.
the cybersecurity side, the bad guys are also evolving and changing every day.
That's right.
That conversation flows back up to the board, which say you have a product everybody loves, and by the way, it's no longer safe to use it. Are we willing to take it out and replace it with something that meets other criteria within our organization? That's a tough board conversation.
Well, it is until it isn't, until it's SalesLoft and you have to turn it off anyway because
That's
now you're
preached.
forced to.
Yep. As long as they
I've-
support you in those decisions, that's where we talk about where that accountability lies. Whomever is willing to make those tough calls, that they have the support they need to do the right thing. And
Mhm.
sometimes we've seen that's not always true.
I've seen some agentic AI coming out, meaning it operates on its own and it functions against something. What's the simplest form is there's a folder in your share, whatever that share happens to be, Microsoft box, whatever happens to be. And there's an agent that sits there and monitors everything that comes through. And a use case for that would be a folder that handles all your contracts, right? And then it pulls the information out of those contracts and puts it into discrete data elements and puts it into a database automatically. So all you do is you do the DocuSign, you drop it into this folder, and it does all these things. I'm more concerned about the proliferation of these agents, either built by us or not built by us, but these agents are going to be sitting there performing work, doing things on an ongoing basis. I think it's a significant attack surface, but even if it wasn't an attack surface for threat actors, I think it's a significant area. Like, we can't manage the stuff we see. Like, this stuff that all of a sudden disappears in the background, we're going to have to get really good at documenting where these agents are, what's the context they're operating in, what's its parameters for governance, how often do we visit that agent to ensure that it's doing what we thought it was going to be doing. There's
a lot of this goes back to that risk conversation that Ed was having. And you're really sort of talking about two things. One is the AI that's built in and is a feature of something that we already own. And then there's this other version of AI, the agent stuff and other things that we're building ourselves or we may be buying separately. And there's risk involved. There's risk on both sides. And we're really rookies at managing it, Ed.
SalesLoft affected 700 plus.
Yeah.
Right?
Yep.
700 plus companies. It was an attack on an API integration. The largest integration we just went through is AI. It's AI. I mean, it's feature, but it's also an integration. And so the minute someone figures out the vulnerabilities, SalesLoft will look like child's play, which it is child's play because I think they're young hackers involved, right? The
Shiny hackers. Yeah.
But yeah, no, we're just scratching the surface as it relates to AI. We haven't even, and I think there's been a nerving quietness about, I mean, even though this is a big event, I wonder what they're doing now as they're organizing. Because they're organized, right? Everyone knows now they're organized, right? And so this SalesLoft looks like a little test in my mind. So what are they really planning? How big is this going to be and when's it going to hit? And AI is probably going to be at the heart of that, Bill, to your point earlier. That's why I think this has to be a board level conversation.
Is that why risk never sleeps?
Yes. Yes, Bill. Yes.
Well, I think maybe we should wrap up the show. This was a good Newsday. It's a good
All right.
time. We went real long, but it's nice to hang out with you, Ed. I really appreciate you being here.
Thank you.
That's Newsday. Stay informed between episodes with our daily insights email. And remember, every healthcare leader needs a community they can lean on and learn from. Subscribe at thisweekhealth.com/subscribe. Thanks for listening. That's all for now.